Picture this. You're driving home from work, the light turns red, and suddenly, boom, a car hits you from behind. You survive with just a broken arm. Scary, but fixable. And then comes the real shock. A hospital bill lands in your mailbox for $26,000. That's the American healthcare system in action. It's not just a health crisis. It's a financial crisis. And it's one that millions of Americans face every single year. If you want to understand the hidden costs of living in the USA, rent, groceries, debt, and yes, healthcare, make sure you subscribe. This is the Money Manual, and today we're breaking down why healthcare in America is bankrupting millions. In the United States, healthcare isn't just about healing, it's about money. For many Americans, a hospital visit feels less like treatment and more like financial punishment. And the numbers prove it. Medical bills are pushing families into debt, draining savings, and in many cases, forcing bankruptcy. That's why today we're asking the tough question. Why are healthcare bills bankrupting Americans? Let's start with the numbers. The average American now spends over $12,000 every year on healthcare. That's not a luxury expense, that's an unavoidable cost. And it's higher than what most people pay for rent. Compare that to Canada, the UK, or Australia, where the yearly cost is often half that, or less. In the USA, healthcare isn't just expensive. It's the single most crushing household bill after housing itself. You might be thinking, well, I've got insurance, I'm safe. Wrong. Insurance in the US doesn't protect you from financial pain. It often adds to it. The average deductible is now $1,700. That means you'll pay almost $2,000 out of pocket before your insurance even starts helping. And that's just the deductible. Premiums, co-pays, out-of-network fees, they all pile up. Insurance is supposed to give peace of mind. But for many Americans, it just feels like paying more money for less protection. Behind every statistic, there's a human story. Families maxing out credit cards to cover ER bills. Cancer patients taking out personal loans just to keep treatment going. Parents crowdfunding their child's surgery on GoFundMe. These aren't rare exceptions. They're becoming the norm in America. And when health becomes a financial decision, people start gambling with their lives. Here's a fact that should shock you. 66% of all personal bankruptcies in America are tied to medical bills. Think about that. Not overspending on luxuries, not gambling, not poor budgeting, just medical bills. That's 2 out of 3 bankruptcies. In the USA, illness doesn't just threaten your health. It destroys your financial stability. Let's talk about the ER. You wake up with chest pain. Panic sets in, you rush to the hospital. Hours later, you leave with nothing but peace of mind until the bill arrives. Average ER visit? $3,000 to $5,000. And that's before the doctor fees or lab tests are added. Need an ambulance? That's another $900 or more. And shockingly, insurance often doesn't cover it. In America, the simple act of calling for help can throw you into debt. Now let's open the medicine cabinet. Americans pay some of the highest drug prices in the world. Insulin costs about $30 in Canada, but across the border in the USA, the exact same drug can cost $300. That's a tenfold difference. People are literally rationing life-saving medicine because they can't afford the price tag. And that decision, skip doses or stretch prescriptions, can cost lives. Here's where it gets very financial. Healthcare isn't just an expense, it's eating the American household budget alive. For the average family, healthcare takes up 20% of total income. That's money that should go to rent, groceries, saving for retirement, or paying down debt. Instead, it vanishes into premiums, bills, and surprise medical charges. For millions, healthcare is the single biggest financial threat they face year after year. Now let's step outside the US for a moment. In the UK, the NHS provides care that's funded by taxes. You don't get hit with a surprise bill after surgery. In Canada, doctor visits and hospital stays are covered by public health care. In Australia, Medicare ensures that at least the basics are protected. But in the US, you're on your own, trapped in a system of private insurance companies and hospital billing departments. No country is perfect, but no other developed nation leaves its citizens this financially exposed. This system forces everyday Americans into impossible choices. Do you pay the rent or do you pay the hospital bill? Do you buy groceries or do you pick up that prescription? Surveys show that nearly half of Americans delay or avoid medical care because they simply can't afford it. That's not a healthcare issue. It's a money one, and it's one that defines life in America today. Here's what most people don't see: the hidden financial toll. It's not just the bill. It's the lost workdays while you recover, the cost of traveling to appointments, The childcare while you're at the hospital. Every hospital visit sets off a chain reaction of hidden expenses that quietly bleed your savings dry. Even a minor surgery can end up costing a family thousands once you add it all up. If you think this is bad now, the future looks even worse. At the current pace, by 2030, the average American household could be spending over $20,000 a year on healthcare. That's like adding a second rent or mortgage payment, except you can't choose to skip it. Unless something changes, healthcare will keep swallowing the budgets of everyday Americans. So let's face it, in the United States, getting sick isn't just a health risk. It's a financial one. Until the system changes, everyday Americans will keep going broke just to stay alive. That's the reality. If you found this eye-opening, subscribe to the Money Manual. Because here, we don't just talk about money. See you in the next one.